Okay, so let's talk a little bit about tennis leg, which is a quite tennis players phenomena, as the name suggests. So we are talking about a myofascial or tendinous injury of the lower limb, and two muscles are very important to understand this. One is the plantaris. You can see here the plantaris muscle, which is hyper intense in this sequence, and the the medial head of the gastrocnemius. Both are important in this phenomena, and both can be together or each one by itself can be ruptured or teared, and usually it happens on tennis players. Now let's look at the plantaris muscle. Let's look at the anatomy a little bit. You can see here the plantaris muscle, the region right over here, and gets to the calcaneus bone right over in the femur, in the area of the lateral, maybe lateral epicondyle or something like this, and here in the calcaneus it can insert. And the other muscle, which is important, is the medial head of the gastrocnemius. So you can see here the gastrocnemius, the medial head can also be torn, and both or injured, and both are called tennis leg. Now, when we're talking about plantaris on MRI, you can see this muscle which runs right over here. You can see the plantaris. You need to remember that it's not a very big, long muscle. Most of it is just like, most of it's like a tendon. You can see right over here the plantaris muscle, and the plantaris muscle right over here. And you can see also the gastrocnemius. The gastrocnemius muscle, oh, no, not here. On MRI, just a sec. Okay, so when we're talking about gastrocnemius, you can see it right over here on the MRI. It's much bigger muscle, and there is a medial head and a lateral head of the gastrocnemius. More deeper to this, we have the soleus muscle. We are not going to talk about the soleus at all. Here's another image of the gastrocnemius muscle. You can see right over here, and soleus, which is a big muscle inside, more deeper, and plantaris, it's not really differentiable, not very good. Okay, again, gastrocnemius muscle, soleus muscle, those are the ones that we are talking about. Medial head of the gastrocnemius, and let's see if they show right in here the plantaris muscle, quite big here. Okay, so tennis leg is rupture or injury for those muscles alone, each one of them, or both. And you can see hyperintense areas which demonstrate the injury. Here you can see even a rupture, so it shouldn't be discontinuation of the muscle. Quite hard to see, but you can see the edema quite good, which tells you that there is an injury to the muscle. Medial head of gastrocnemius, soleus, and what else we can see? The plantaris muscle, plantaris, soleus, plantaris. You can see the anechoic that may tell you that there is an injury to the muscle. Not very easy to see, not very easy to diagnose. Not very easy. This is a more water sensitive sequence, so maybe we'll be able to see more, more easily the gastrocnemius medial head. You can see here the hyperintensity, which is the edema of the muscle secondary to a injury. Okay, so in the differential diagnosis, you need to remember very important things. We have deep brain thrombosis. You need to look for Doppler and for the veins, deep and superficial veins, and a ruptured Baker cyst that may also cause posterior leg pain. And of course, the cystic appearance and popliteal artery aneurysm, which is a differential diagnosis for Baker cyst itself. So there is a differential for tennis legs. So more importantly, to know this diagnosis in order to understand what is the differential for posterior leg pain. There is a one exception for this innocent diagnosis, Dennis leg, which is a compartment syndrome. If all the edema cause compression of this side, so there may be compartment syndrome secondary to the swelling, which can be severe, and then you need to intervene and do a surgical fasciotomy. But usually this uh, diagnosis is self-limiting and quite benign, but the differential, the complications are important to identify in order to treat what you need to treat and not to treat what you don't need to treat. So this is the importance of this diagnosis to understand that this is the problem and not another thing that may be very, very devastating to the patient. So this is about the tennis leg. Importantly, epidemiologically, more common in tennis players. Thank you very much. If there is a, if there is something that I said wrong or something, please let me know. And thanks for Radiopedia for these images and this paper. Thank you very much. And that's it about tennis leg.